Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. Most people who have periodontal disease aren't even aware of it. It's rarely painful, especially in the early stages. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it starts to get onto the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Bacteria that cause periodontal disease thrive here. Bacteria, like the ones in this slide, produce toxins. And it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Some of the warning signs are persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums shrinking away from the teeth, loose teeth, and changes in the spaces between your teeth, which reflect changes in the underlying bone. A person can also have periodontal disease and experience none of these warning signs. The roots of teeth extend into the bone of the jaw. When everything is healthy, the bone comes up around the necks of the teeth, and it's even throughout the mouth. A sulcus is the crevice between the tooth and the gums. A healthy sulcus is 2 to 3 millimeters deep. When plaque and tartar invade a sulcus, and it becomes deeper than 3 millimeters, we call it a pocket. Once bone has been lost, it never grows back. When too much bone is lost, there's so little support for the teeth, they get loose and have to be removed. Since you may have periodontal disease yet have none of the symptoms, we perform a thorough examination using X-rays and a periodontal probe to measure bone levels around the teeth. When the bone level falls, the gums pull away from the tooth, forming a pocket. We measure the depth of this pocket with a periodontal probe. The measurement is from the bottom of the pocket, where the gum is attached to the tooth, to the top of the gums. These are healthy gums. They're tight against the teeth, and there aren't any pockets. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. Bleeding is a sign of infection. Healthy gums don't bleed. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are compared with the healthy mouth. So now you know how we diagnose periodontal disease. Probe readings greater than 3 millimeters, bleeding upon probing, swollen and red gums, especially between the teeth, and bone loss or tartar on the X-rays. The goal of root planing is to eliminate the source of periodontal infection by removing the plaque, tartar, and bacterial toxins from the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Routine cleanings remove plaque and calculus from above the gum line. Root planing removes plaque and calculus from below the gum line. To keep you comfortable, we usually numb you before root planing begins. Using instruments like these, we carefully and meticulously plane the root surfaces. Once the source of infection is removed, your gums begin to heal. As they heal, your gums will tighten around your teeth. Home care is the key to keeping this healing going. Since brushing and flossing only go about 3 millimeters below the gum line, something more is needed to clean the deeper pockets of periodontal disease. We'll give you the tools and techniques to do it as part of your treatment. Normally, we spread root planing across several appointments. This way we can check the healing and help you fine-tune your home care efforts. A microscope is a new tool to dentistry that really helps in the treatment of periodontal disease. The bacteria that cause periodontal disease thrive below the gum line. To look at the bacteria from a person's mouth, we take a small plaque sample from a pocket and place it on a slide. This is a slide from a healthy mouth. This is a slide from a mouth with active periodontal disease. These are spirochete bacteria, and they're one sign of active periodontal disease. You'll see your own slides when we use the microscope to help you judge the success of your own periodontal treatment. That way, you may be able to see the return to health in your own mouth after root planing. Periodontal disease is an infection of the teeth, gums, and the bone that surround the teeth. It's caused by specific bacteria that live in the deepening space between the tooth and gum that's called a pocket. The bacteria that cause periodontal disease trigger the body's immune system to produce enzymes. And it's these enzymes that actually cause the bone to be lost. If left untreated, this destruction of supporting bone eventually leads to tooth loss. Periodontal disease is in fact the #1 cause of adult tooth loss. The traditional treatment for periodontal disease has always included a series of steps, starting with the removal of plaque and tartar from the root surfaces. This is called root planing. After healing, the areas are reevaluated, home care techniques are modified, and in severe cases, surgery is recommended. Recent breakthroughs have led to the development of another effective tool in the ongoing fight against periodontal disease. It's called Periostat. This is Periostat. It's taken not for its antibiotic effect, but for its inhibiting effect on the bone-destroying enzymes that are released by the body as a result of periodontal disease. We usually prescribe Periostat for a number of months. It's normally taken twice a day, 1 capsule in the morning and 1 in the evening, about an hour before meals. When used in combination with root planing and new home care techniques, Periostat reduces pocket depth, inhibits the destructive enzymes that cause bone loss, and promotes a healthy gum-tooth attachment. We won't prescribe Periostat if you're allergic to tetracyclines, pregnant or nursing, or for infants or children under 8. Periostat, an important new medicine that we recommend in combination with root planing and new home care techniques to help stop the ongoing damage caused by periodontal disease. Periodontal flap surgery is necessary when pockets and infection still remain after root planing. After making sure all the areas are completely numb, we gently separate the gums from the tooth. This creates a flap and gives us access to the infected areas. We then remove any plaque and tartar from the root surfaces. The area is reshaped, and the gum line is adjusted to make it easier for you to keep the teeth plaque free. Any soreness after surgery can usually be handled well by mild pain medication. Periodontal flap surgery removes the source of infection, reduces the size of the pockets, makes cleaning easier, and raises your overall level of health. When everything is healthy, your gums are snug against the teeth, and the root doesn't show. Unfortunately, in some cases we see something more like this. The gums have pulled away from the tooth, and some of the root surface is exposed. This apparent lengthening of the teeth can really age a person's smile. If left uncorrected, the loss of protective gum tissue may also mean even more severe problems down the road. Fortunately, a procedure called grafting can correct this problem. The first step in placing a graft is to thoroughly numb the involved areas. Then the graft is taken from the donor site on the palate. In some cases, the incision heals on its own. In other cases, it's closed with a stitch or two. At the site of the graft, we gently separate the gums from the tooth. This creates a flap and gives us access to the area. We then carefully remove any plaque and tartar from the root surfaces. The graft is strategically placed and carefully stitched in place. After healing for a few weeks, the grafted tissue blends in beautifully. The results? The gums have been restored and strengthened, the root surface is covered and protected, and the tooth now has a much more natural and pleasing appearance. Healthy gums, tight against the necks of the teeth, are an important part of a beautiful smile. But sometimes a problem like this can develop. As the gums extended onto the front surface of the teeth, the natural balance between the length of the teeth and the height of the gums was lost. The first step in a gum reduction procedure is making sure that all of the involved areas are completely numb. We then carefully make a small incision and remove the excess gum tissue. After a couple of weeks, the area will be completely healed. Notice how much more natural this area looks after the procedure. A gum reduction procedure is a safe and predictable way to remove excess gum tissue and improve the natural appearance of a person's smile. When a tooth is broken down due to decay or fracture, a crown is an excellent way to cover and protect it. In cases like this, when the damage is more severe, there may not be enough remaining tooth structure to adequately support a crown. Years ago, a tooth like this would have to be extracted. But today, by using a procedure called crown lengthening, we can increase the amount of available tooth structure and save the tooth. The first step in this procedure is thoroughly numbing the entire area. Incisions are placed and the gums are gently pulled back. The area is then reshaped and sculpted to the desired shape. The gums are replaced and a couple of stitches are placed to speed healing. After a few weeks of healing, a crown is placed to cover and protect the damaged tooth. Crown lengthening is a minor surgical procedure that is a predictable and effective way to save a tooth that might otherwise be lost. If you have periodontal disease, your choices are limited. You may choose treatment or to delay treatment. Treatment involves a combination of root planing, new home care techniques, more frequent dental cleanings, and in severe cases, surgery. Delaying treatment will never make periodontal disease go away. Periodontal disease is an ongoing degenerative disease. Bone lost never grows back. If too much bone is lost, teeth get loose and have to be removed. This means you may end up wearing partial dentures or even full dentures. You don't have to lose your teeth to periodontal disease. Treatment removes the infection and keeps the disease under control.